Welcome to Exploring Alternatives in Medicine, the podcast that explores unconventional approaches to health and wellness. In today's episode, we're delving into the fascinating world of antiparasitic drugs and their potential in the realm of cancer treatment. Join us as we explore 10 drugs that have shown promising anti-cancer potential and uncover the intriguing research findings surrounding their effects on cancer cells and tumor growth. Don't forget to subscribe to stay updated on our latest episodes. In today's episode, we'll cover the potential anti-cancer effects of antiparasitic drugs such as ivermectin, hydroxychloroquine, and fenbendazole, as well as other drugs like niclosamide, albendazole, mebendazole, praziquantel, nitazoxanide, artemisinin, and mefloquine, while emphasizing the need for more research and clinical trials. Additionally, we'll discuss the importance of seeking professional advice from a compounding pharmacy before considering off-label use and custom medication.
Oh yes, I'm happy to assist you with that. So we've got a list of 10 antiparasitic drugs that have been shown to potentially have anti-cancer effects. You mentioned a few of them, but I'll go ahead and give you the expanded list. First up, we have ivermectin. This drug not only serves as an antiparasitic medication, but it has also exhibited anti-cancer potential by inhibiting cancer cell growth, inducing apoptosis, and suppressing tumor growth in various types of cancer. Next on the list is hydroxychloroquine. Although it's primarily used as an anti-malarial drug, it has been studied for its potential anti-cancer effects. It can inhibit autophagy, a cellular process that can promote cancer cell survival, and has been investigated as a possible adjuvant therapy for other anti-cancer treatments. Moving on to fenbendazole, which is commonly used in veterinary medicine as an antiparasitic medication. Studies have shown that it has the potential to inhibit tumor growth in animal models and target cancer cell metabolism. Niclosamide is another drug that has shown anti-cancer properties in addition to being an antiparasitic medication. It has been found to inhibit cancer stem cells, inhibit cell proliferation, and promote cell death in various cancers. Albendazole has demonstrated potential as an anti-cancer agent by inhibiting cell proliferation, inducing apoptosis, and interfering with microtubule function in cancer cells. Mebendazole, another antiparasitic drug, has also shown promising anti-cancer activity by inhibiting cancer cell growth, inducing apoptosis, and disrupting tumor growth. Praziquantel is commonly used to treat parasitic infections like schistosomiasis, but it has also been studied for its potential anti-cancer effects by inhibiting cancer cell migration, inducing cell cycle arrest, and promoting apoptosis. Nitazoxanide, primarily used for parasitic infections such as giardiasis, has also exhibited anti-cancer activity by inducing cell death, inhibiting cell proliferation, and interfering with cancer cell signaling pathways. Artemisinin and its derivatives are derived from the herb Artemisia annua and primarily serve as anti-malarial drugs. However, research has suggested their potential anti-cancer effects, particularly in certain types of cancer such as leukemia, breast, colon, and lung cancer. Last on the list is mefloquine, which is primarily used for the prevention and treatment of malaria. This drug has demonstrated anti-cancer activity in preclinical studies by inducing cell death and inhibiting cancer cell migration and invasion. It's crucial to note that while these drugs have presented potential anti-cancer effects in preclinical studies or in specific cancer models, further research is needed to establish their efficacy, safety, and optimal clinical applications in human cancer patients. Oncologists and healthcare professionals should always be consulted to determine the most appropriate treatment options for cancer patients. Have you ever heard of ivermectin? It's an antiparasitic drug that's primarily known for its effectiveness in treating infections caused by parasites, such as roundworms and mites. However, interestingly, some research suggests that ivermectin may also have potential anti-cancer properties. Various studies have looked into the potential anti-cancer effects of ivermectin in different cancer types. In laboratory settings and animal models, ivermectin has shown inhibitory effects on cancer cell growth and proliferation. Researchers have found that it induces apoptosis, which is programmed cell death, in cancer cells. Moreover, ivermectin has been reported to inhibit angiogenesis, the process of forming new blood vessels that tumors depend on for growth. These intriguing findings have led to interest in exploring the potential use of ivermectin as an anti-cancer agent. It's important to approach these studies with caution, though. Most of the available research on ivermectin's anti-cancer effects is preclinical, meaning it has been conducted in laboratory settings or animal models, and not yet in human clinical trials. To determine the safety and efficacy of ivermectin specifically for treating cancer in humans, clinical trials are necessary. While there have been some early-phase clinical trials investigating ivermectin's potential in certain types of cancer, the results are still preliminary. Larger, well-designed trials are needed to draw definitive conclusions. Another thing to note is that even if ivermectin were to show promise as an anti-cancer agent, the doses required for cancer treatment might be higher than those used for its antiparasitic properties. This bears the risk of increased side effects. So while there is some evidence suggesting that ivermectin may have potential in treating cancer, it's crucial to proceed with caution. We need further research, including well-designed clinical trials, to determine the safety, efficacy, and optimal dosages of ivermectin for cancer treatment. As always, it is recommended to consult with a qualified healthcare professional for guidance on cancer treatment options.
Well, let's talk about hydroxychloroquine, shall we? It's a medication that has traditionally been used to prevent and treat malaria. Interestingly, it's also prescribed for conditions like rheumatoid arthritis and lupus. But what about its potential use in cancer treatments? This has been a topic of research and investigation for some time, and it's all tied to a cellular process called autophagy. You see, autophagy is a fancy term for the self-recycling system that cells use to dispose of or reuse unnecessary or dysfunctional components. In most cases, this is a good thing as it contributes to cell survival and health. However, it's been found that cancer cells can actually use this process to their own benefit, allowing them to continue growing and spreading. This is where hydroxychloroquine comes in. Some studies have suggested that it can actually inhibit autophagy, which could potentially make cancer cells more vulnerable to the effects of other anti-cancer treatments. For instance, by preventing cancer cells from using autophagy to survive chemotherapy, this medication could enhance the effectiveness of other treatments. Now, it's important to note that while the theory is promising, it's still in the investigation stage as of September 2021. While some studies have shown positive results, further research is needed to fully understand how hydroxychloroquine might be used in cancer treatments. For instance, we're still not sure what types of cancer it could be effective against, nor what the ideal dosages in combination with other treatments might be. So, if you're interested in the most current and accurate information on this topic, I recommend you look at recent peer-reviewed research or consult with medical professionals.
Have you ever heard of fenbendazole? It's an antiparasitic drug commonly used in veterinary medicine to treat intestinal parasites like roundworms, hookworms, and whipworms in animals. But that's not all it might be useful for. In recent years, researchers have been investigating fenbendazole's potential as an anti-cancer drug. So what makes fenbendazole potentially effective against cancer? Well, the primary mechanism behind its anti-cancer effects is its ability to disrupt the process of microtubule formation, which is essential to the functioning and division of cells. By interfering with this process, fenbendazole could potentially inhibit the growth and proliferation of cancer cells. Additionally, it might induce changes in cancer cell metabolism that make them more receptive to other treatments. While laboratory studies and animal models have shown promising results, more research is needed, especially in human subjects, to determine fenbendazole's safety and effectiveness as an anti-cancer drug. Clinical trials are a critical step in drug development to ensure that the treatment is safe and effective for use in humans. It's important to remember that what works in a laboratory or animal model might not necessarily work in humans, or it could even have unexpected side effects. Therefore, while these findings are certainly exciting, it's best to approach them with cautious optimism. As always, consult with a healthcare professional or trusted medical source for the most current and personalized advice.
Have you ever heard of niclosamide? It's a medication that's typically used to treat tapeworm infections. But did you know that researchers have been studying its potential as a cancer treatment? Niclosamide has been shown to have several mechanisms of action against cancer. One promising strategy is its ability to target cancer stem cells, which are a subpopulation within a tumor. By targeting these cells, niclosamide could potentially affect the root of the tumor. Another way that niclosamide fights cancer is by inhibiting cell proliferation. This means it slows down or stops the rapid growth and division of cancer cells, which could limit the progression of the disease. Lastly, niclosamide might promote apoptosis, or programmed cell death, in cancer cells. This is significant because in many types of cancer, the mechanisms controlling apoptosis are faulty. By promoting apoptosis, niclosamide could help to restore balance and prevent the continued growth of the cancer. Although these findings are promising, as of September 2021, niclosamide's use as an anti-cancer drug is still being studied. Further research, including clinical trials in humans, is necessary to fully understand its effectiveness and which types of cancer it might be best suited to treat. As always, for the most up-to-date information, refer to the latest research or consult with healthcare professionals.
Albendazole is a medication that's commonly used to treat parasitic worm infections. It's well tolerated and highly effective against various types of parasites. But did you know that it might also have anti-cancer properties? That's right, some of albendazole's effects on cells suggest that it could potentially be developed into a cancer-fighting drug. There are a few ways in which anti-cancer medications work, and albendazole seems to have a hand in some of them. For instance, it can inhibit the growth and division of cells. This is a critical process that helps prevent cancer cells from multiplying and spreading throughout the body. Additionally, some medications can induce apoptosis, or programmed cell death. This is a natural process that keeps the body's cells in balance. However, cancer cells can often disrupt this process, allowing them to grow uncontrollably. Albendazole might be able to restore this balance by inducing apoptosis in cancer cells. Lastly, microtubules are structures within cells that play crucial roles in cell division. Some anti-cancer drugs work by disrupting the function of microtubules, which can help prevent the growth and spread of cancer cells. Interestingly, albendazole might also be able to interfere with microtubule function. While there is promising research suggesting that albendazole could be developed into an anti-cancer drug, it's important to keep in mind that these possibilities are still largely theoretical and require further investigation. Clinical trials will need to be conducted to determine whether albendazole is safe and effective for use in humans as a cancer treatment. As with any potential new treatment, it's crucial to approach these findings with cautious optimism and seek the most up-to-date and accurate information from healthcare professionals and reliable sources of research. If you've ever had to deal with a parasitic worm infection, you might have come across the antiparasitic drug, mebendazole. This medication is commonly used to help get rid of nasty worms in our bodies. But did you know it's been in the news recently? Some studies have looked into the possibility that mebendazole could also be used as an anti-cancer drug. So, what are these potential anti-cancer properties? Well, the studies suggest that mebendazole could affect cancer cells in a few different ways. Firstly, it could potentially inhibit the growth and proliferation of cancer cells, basically stopping them from getting bigger and more problematic. This could be a major breakthrough for cancer patients, but it doesn't stop there. Mebendazole could also induce apoptosis, or programmed cell death in cancer cells. When cancer cells begin to grow uncontrollably, this process can be disrupted, leading to growth and development of the tumor. So if mebendazole can cause apoptosis in cancer cells, it could potentially help to restore balance and prevent further growth or spread. Finally, mebendazole may also disrupt tumor angiogenesis, the process by which tumors form new blood vessels to supply themselves with nutrients and oxygen. If mebendazole can disrupt this process, essentially starving the tumor, it could potentially inhibit the growth and spread of cancer. It's important to note, however, that more research is needed before mebendazole can be defined as an effective anti-cancer drug. Clinical trials in humans will be a critical part of this process. Just like with any new drug or treatment, we should approach these findings with cautious optimism. So for the most accurate and up-to-date information, refer to the latest research or consult with healthcare professionals.
Have you ever heard of Praziquantel? It's a medication that's commonly used to treat infections caused by parasites, specifically schistosomes and other flatworms. The way it works is by messing with the membranes of the parasites, causing them to die off. Fascinating, right? But get this. There's been some research into the potential of Praziquantel as an anti-cancer agent. Researchers have identified a few key areas of investigation, so let's dive in. First up, inhibition of cancer cell migration. Basically, cancer cells have the ability to move and invade other areas of the body, which is obviously one of the main reasons why cancer is so difficult to treat. If Praziquantel can prevent or inhibit this process, it could possibly slow down or even stop the spread of cancer altogether. Another potential effect of Praziquantel as an anti-cancer drug is the induction of cell cycle arrest. Essentially, the cell cycle is how cells grow and divide, and disruptions of this process can lead to uncontrolled cell growth, that is cancer. Some anti-cancer drugs work by making it so that cancer cells can't divide or multiply. If Praziquantel can do this too, that would be pretty promising. Lastly, Praziquantel might also promote apoptosis, meaning programmed cell death. Apoptosis helps keep a healthy balance of cells in the body, but some types of cancer throw off this delicate balance. If Praziquantel is able to trigger apoptosis of cancer cells, it could help restore equilibrium and potentially halt the spread of cancer. It's important to keep in mind that this research is still in its early stages. While these potential benefits of Praziquantel are exciting, there's still a lot more to learn. We'll need more studies and clinical trials in humans to get a better understanding of how the medication can be used to treat cancer. As always, be sure to consult with healthcare professionals or check the latest research for the most accurate and up-to-date information.
Nitazoxanide is an antiparasitic medication that's commonly used to treat infections caused by the protozoa Giardia lamblia and Cryptosporidium parvum. However, recent research has shown that nitazoxanide has the potential to be used as an anti-cancer agent. Some preclinical studies have indicated several mechanisms of action that nitazoxanide may have against cancer. Firstly, nitazoxanide could induce apoptosis or programmed cell death in cancer cells, which is critical for maintaining healthy cell numbers and functions in our bodies. Secondly, nitazoxanide could also inhibit the rapid growth and division of cancer cells, a crucial strategy in cancer therapy. Thirdly, nitazoxanide could interfere with cancer cell signaling pathways, a complex network of communication that governs cellular activities and coordinates cell actions. The disruption of these pathways can lead to uncontrolled cell growth seen in cancers. Hence, nitazoxanide could potentially help to limit the growth and spread of cancer. However, it's crucial to approach these findings with cautious optimism. As of September 2021, more research was needed, especially clinical trials in humans, to confirm the safety and efficacy of nitazoxanide as an anti-cancer agent. Therefore, it's advisable to always consult healthcare professionals or refer to the latest research for the most accurate and up-to-date information.
Artemisinin and its derivatives may be more than just a potent anti-malarial. Recent preclinical studies have highlighted their potential as anti-cancer agents, and the mechanism by which they work is fascinating. They can induce apoptosis in cancer cells or stimulate their programmed death, thereby effectively curbing their uncontrolled growth. Also, these compounds generate reactive oxygen species that can induce oxidative damage in cancer cells, leading to their demise. As cancer cells require new blood vessels to spread, artemisinin compounds may cut off their supply of nutrients, thereby impairing their growth. Though there's an ongoing debate on the effectiveness of artemisinin and its derivatives in fighting cancer, the preclinical data looks promising. However, more clinical trials in humans are needed to establish their safety and effectiveness fully. So while we should be cautiously optimistic about these findings, we must consult healthcare professionals for the most accurate information.
Hey there! Today we're going to dive into the topic of mefloquine, an anti-malarial drug that's been recently investigated for its potential anti-cancer activity. As you may already know, mefloquine is primarily used for preventing and treating malaria, especially in areas where other anti-malarial drugs have proven ineffective. According to several studies, mefloquine has the ability to induce cell death or apoptosis in cancer cells, limiting the growth and spread of tumors. Furthermore, it has the potential to inhibit cancer cell migration and invasion, which is a vital factor for cancer metastasis. The prospect of mefloquine as an anti-cancer drug is indeed exciting. However, it's worth noting that the research on this topic is still in its early stages. Further clinical trials in humans are required to confirm the safety and effectiveness of mefloquine as an anti-cancer drug and find out which types of cancer it can truly treat. Remember, for the most accurate and up-to-date information, it's always best to check the latest research or consult with healthcare professionals.
Welcome back to Exploring Alternatives in Medicine, where we dig deep into innovative healthcare options. In today's episode, we've talked about the potential of various antiparasitic drugs in the realm of cancer treatment. While these medications show promise, it's essential to consult with healthcare professionals before considering any off-label use. If you're intrigued by the possibilities we've explored and looking for a compounding pharmacy that can help with customized formulations, we want to highlight Pharmaprodia Compounding Pharmacy in Surprise, Arizona. At Pharmaprodia, they specialize in compounding medications that meet the unique needs of patients. They recognize that no two individuals are the same, and they're committed to providing personalized solutions tailored to each person's specific requirements. Whether you're interested in natural bioidentical hormones, alternative dosage forms, or dermatological preparations, Pharmaprodia's team of experienced pharmacists can assist you. They have the knowledge and resources to create customized medications that align with your healthcare provider's recommendations and address your unique needs. If you've been considering the possibility of compounding any of the antiparasitic drugs we discussed today, contacting Pharmaprodia is an excellent starting point. They can determine the availability and feasibility of compounding those medications based on your individual circumstances. However, it's important to remember that while compounding pharmacies like Pharmaprodia can provide valuable services, the decision to pursue any treatment should always be made in consultation with a licensed healthcare professional. So, if you're interested in exploring compounding options or discussing the possibility of customized medications, don't hesitate to contact Pharmaprodia Compounding Pharmacy in Surprise, Arizona. Their friendly staff is standing by to listen, provide information, and help you take the next steps on your health journey. Thank you for tuning in to this episode of Exploring Alternatives in Medicine. Remember, it's crucial to stay informed, ask questions, and work with healthcare professionals who can guide you towards the best solutions for your health. Stay curious, stay proactive, and keep seeking out innovative approaches to your well-being. So that's our wrap on antiparasitic drugs as potential cancer treatments, including ivermectin, hydroxychloroquine, fenbendazole, niclosamide, albendazole, mebendazole, praziquantel, nitazoxanide, artemisinin, and mefloquine, with the reminder to seek professional advice before considering off-label use and customized medication. Thanks for listening to today's episode. I'll see you guys at the next one, and don't forget to subscribe.